Imagine this. You step in your barn, ready for your usual morning routine with your horse,
Yeah.
and something just feels, well, off.
Yeah.
Maybe they're a little stiff, not quite themselves, or you notice some subtle swelling you can't quite explain. Think, my horse is usually so full of life. What could this be? It's a puzzle, right? A mystery that might be pointing to a specific equine health challenge we're diving into today. Equine Granulocytic Anaplasmosis, or EGA for short.
Exactly.
Welcome to the deep dive. Today, we're taking a close look at EGA. We've pulled from some really comprehensive overviews and detailed veterinary research on the disease, its diagnosis, and the treatment side of things.
What's stuff?
Our mission really is to cut through the complexity and give you, our listener, a clear, actionable understanding of this condition so you can be, truly well informed.
And it's important because while the name equine granulocytic anaplasmosis might sound like a bit of a mouthful, understanding it is incredibly important for anyone who cares for horses. It's actually a pretty common issue in many parts of the world, and just knowing what to look for can make all the difference.
Okay, let's unpack this mystery then. What exactly is EGA at its core? At its most basic, equine granulocytic anaplasmosis, or EGA, and it actually used to be known as equine granulocytic ehrlichiosis, which is interesting.
Right, they renamed it.
Yeah, it's a seasonal disease that's carried by ticks. It's caused by a specific type of bacteria, Anaplasma phagocytophilum. And here's a crucial detail. These bacteria are, well, they're quite sneaky. They live and multiply right inside certain cells within your horse's body.
That's right, they're intracellular. And when we talk about tick-borne, we're primarily talking about a specific type of tick, the Ixodes species.
Yeah.
So in the eastern and midwestern U.S., you're probably thinking of Ixodes scapularis, the black leg or deer tick. Out west, it's more likely Ixodes pacificus, the western black-legged tick. But really, globally, wherever you find these Ixodes ticks, you potentially find this disease.
And here's where it gets really interesting, and frankly, probably a bit of a relief for horse owners. Horses are what we call dead-end hosts for EGA. This means, surprisingly, that if your horse has it, they actually cannot directly pass it on to other horses in the pasture.
That's a huge point.
Yeah, the only way the disease spreads is when an infected tick, which usually needs to feed for, at least a couple of hours, up to maybe 36 hours?
Yeah, somewhere in that window, typically 2 to 36 hours, it needs that time to transmit the bacteria. When that infected tick bites your horse, that's the transmission event.
Right.
That's a key distinction. The bacteria themselves are actually picked up by ticks when they feed on wild animals. Think of rodents, deer.
Oh, okay.
These animals act as reservoirs, basically keeping the bacteria circulating within the environment, ready for the next tick nymph or adult to pick it up and potentially pass it on to a horse.
Okay, so it's kind of an environmental cycle involving wildlife and ticks. So if your horse is in a high-risk area, where might that actually be?
Well, we definitely see higher prevalence in places like the Sierra Nevada foothills and the northern coastal range of California, also large parts of the eastern and midwestern USA.
Right.
But like you said earlier, it's not just a North American issue. It's diagnosed all over Europe, Germany, Switzerland, the UK, for instance, plus Canada, parts of Asia and Africa, too. It's pretty widespread.
And the timing matters, too, right? The seasonality.
Oh, absolutely. In some regions, like California, you'll see the most cases pop up in late fall, winter, and spring.
Okay.
But in other areas, it can really be a risk from spring right through the fall. It all depends on when those specific Ixodes ticks are most active in that particular environment.
And when we look at who it affects, it's mainly horses, right?
Primarily horses, yes. Though, interestingly, donkeys can be infected experimentally, so they're susceptible. But there's no particular breed or sex that seems more prone to it.
But what's quite surprising, you mentioned, is the age factor. That older horses tend to get hit harder.
Yeah, that's a really consistent finding. Horses aged 4 years and older typically are the ones that show the most severe clinical signs.
Yeah.
But that said, we've definitely seen it diagnosed in foals as young as, believe it or not, 2.5 months old. So age isn't complete protection, but it influences severity.
Wow. So let's connect this then. Once an infected tick bites your horse, what's actually happening inside their body? How does it cause those symptoms we might see?
Well, those Anaplasma phagocytophilum bacteria we talked about, they have a specific target. They go after certain white blood cells, mainly neutrophils, which are key immune cells, and sometimes eosinophils too.
Right.
They absolutely invade these cells and start to multiply inside them, forming these little characteristic clusters, almost like tiny berry clusters. inside the cell's cytoplasm. Vets call these morulae.
Morally, okay.
And this invasion, this internal multiplication, it kicks off a pretty significant inflammatory response throughout the horse's whole system.
Right, a systemic thing.
Exactly. Now, while the precise mechanisms are still being fully worked out, we know it can directly damage those infected white blood cells. And importantly, it causes something called vasculitis.
Vasculitis. That sounds like vessel inflammation.
Precisely. Inflammation of the small arteries and veins. And that's a key player because it's this vasculitis that explains a lot of the outward signs you might see, like edema, that swelling, often in the legs. And petechiae, those tiny little pinpoint hemorrhages you might see on the gums or inside the eyelids. That's from leaky, inflamed blood vessels.
So the internal inflammation directly leads to what we're seeing on the outside. That makes sense.
Yeah.
What else does this infection do to their blood work if you were to pull a sample?
It definitely impacts blood components. Most notably, and this is a real hallmark sign, we often see a significant drop in the platelet count. That's called thrombocytopenia.
Thrombocytopenia, low platelets.
Yep. Platelets are crucial for blood clotting, so when their numbers plummet, that's why you see those petechiae, those little bruises or hemorrhages appearing.
Got it.
You'll also typically see a decrease in the overall white blood cell count, especially the neutrophils and lymphocytes, those cells fighting the infection. This often shows up maybe 3 to 5 days after the symptoms start, and sometimes, maybe a little later, you might see mild anemia develop too.
So the clock starts ticking once the tick bites. How long does it usually take before we see those noticeable signs? And what exactly should owners be looking out for?
The incubation period, from the tick exposure to when the horse actually starts showing signs, is usually somewhere between 1 and 3 weeks.
Okay, 1 to 3 weeks.
Yeah. And when you finally notice something, the most common thing really is a high fever. Often it spikes, maybe goes up and down, but reaching 103 to 106 degrees Fahrenheit or even higher, that's present in like over 90% of cases.
Wow, that high.
Oh, yeah. And along with that, your horse will likely be lethargic, depressed, just really off their feed, not interested in eating.
And you mentioned the swelling before.
Right, lymphedema. Swelling, particularly often in all 4 lower legs, that's a direct result of that vasculitis we talked about, fluid leaking from the damaged vessels. Though, interestingly, it might be less obvious or even absent in really young horses, like foals.
Okay. What about those little hemorrhages?
Yes, you might spot those small petechiae, those pinpoint red dots, or even larger bruise-like patches called ecchymosis, often on their gums, or the conjunctiva around their eyes, the sclera, other mucous membranes.
Right.
Jaundice, which is that yellowish tinge to the gums or the whites of the eyes, is also pretty common. And then behaviorally, they might just be really reluctant to move, seem stiff, show signs of muscle soreness, and in some cases, though it's less common, they might even seem uncoordinated or ataxic.
And you said age plays a big role in how bad this looks.
It really does seem to. Foals, say less than a year old, often show very mild signs, sometimes almost nothing noticeable, maybe just a slight fever that comes and goes. Yearlings and young adults, maybe 1 to 3 years old, they typically have the fever, the depression, maybe some mild limb swelling, sometimes that ataxia. But it's usually the adult horses, and especially the older geriatric ones, that tend to exhibit the most pronounced and severe signs of the disease. They get hit the hardest.
And are there any, really rare but serious complications?
Yes, though thankfully rare. In some severe cases, you might see significant muscle issues, like severe myopathy with muscle pain and elevated muscle enzymes, or even neurological signs like profound depression, an inability to stand, recumbency. Sometimes swelling in the upper airway can make swallowing difficult. And very rarely, heart issues like arrhythmias or myocarditis have been reported.
Okay, so you're a horse owner. You've seen some of these concerning signs, the fever, the lethargy, maybe the swelling, and you suspect EGA. How do veterinarians actually go about confirming it and, importantly, ruling out other serious things that might look similar?
That's a critical step, absolutely. Vets rely on putting together a puzzle, really. It's a combination of factors.
Yeah.
Those clinical signs you just described, the whole epidemiological picture, is it the right time of year? Are you in an area known for these ticks? Is there a history of tick exposure?
Right.
And then, most importantly, confirming it with laboratory tests. Because we do have to consider other possibilities, what we call differential diagnoses. Things like viral encephalitis, severe liver disease causing neurological signs, purpura hemorrhagica, which also causes edema and petechiae, equine infectious anemia, equine viral arteritis.
Yeah.
Some of these can mimic EGA's symptoms.
Wow, quite a list.
Yeah, it really pushes vets to think critically and use diagnostics effectively.
So when they send samples off to the lab, what are the key tests they're running? What are they looking for?
Well, a complete blood count, or CBC, is almost always the starting point. And the most striking finding there, the real hallmark of EGA, is that thrombocytopenia, that significantly low platelet count.
Right, the low platelets causing the bruising.
Exactly. It's present in over 90% of cases, often severely low. You'll also likely see that low white blood cell count, particularly low neutrophils and lymphocytes, often appearing a few days after the symptoms start. Sometimes mild anemia shows up too. And you might see signs of systemic inflammation like high fibrinogen levels.
And I remember you mentioned those little clusters inside the cells, the morulae. Can vets actually see those under a microscope?
Yes, absolutely. The definitive diagnosis often comes from examining a blood smear carefully under the microscope. We're specifically looking for those characteristic blue-gray to dark blue inclusion bodies, the morulae, right inside the cytoplasm of the neutrophils, and sometimes the eosinophils.
Okay.
They typically become visible a few days into the illness, and if we do what's called a Buffy coat smear, which concentrates the white blood cells, it increases our chances of spotting them. It's truly a smoking gun finding when you see them.
But they might not always be easy to find.
Exactly. Early on in the disease, they can be scarce. Or sometimes they can be confused with other things you might see in neutrophils, like doll bodies. So while finding them is diagnostic, not finding them doesn't completely rule it out, especially early on.
Okay. So what's the most sensitive test, especially if it's early days?
For sensitivity, particularly in that acute stage, we rely heavily on PCR, or polymerase chain reaction. This test is incredibly powerful because it detects the actual Anaplasma phagocytophilum DNA itself right in the horse's blood or Buffy coat sample.
Ah, looking for the genetic material.
Precisely. So it's really valuable very early in the disease, maybe even before the morulae are visible, or sometimes even if antibiotic treatment has already been started, because it's so specific for the bacteria's DNA.
And what about antibody tests? I often hear about serology being used for tick diseases.
Yeah, serology is another tool. Typically, it's an indirect fluorescent antibody test, or IFA test. This detects the antibodies the horse produces in response to the infection. So, finding a specific type of antibody called IgM often indicates a recent or currently active infection.
Okay.
Now, here's a fascinating and sometimes tricky detail about serology for EGA. While seeing a fourfold or greater rise in the other main antibody type, IgG, between two samples taken a few weeks apart definitely confirms exposure.
Right, shows the immune system reacted.
Exactly. But a single negative result, especially early on, doesn't necessarily rule out an acute infection. And that's because it can actually take quite a while, sometimes up to 19 days, sometimes even as long as 81 days in studies for those antibodies to develop to detectable levels.
Wow, that's a long time.
It can be. And once those IgG antibodies do develop, they can stick around for years. So serology tells us if the horse has been exposed at some point. But it's not always the best test for diagnosing an active current infection right now unless you have that rising IgM or paired IgD samples.
Yep.
PCR is usually better for the acute phase.
That's really helpful clarification. Okay, so the puzzle pieces fit. The diagnosis is confirmed. It's EGA. What's the path to recovery? What does treatment look like? Is it effective?
The really good news here is that treatment for EGA is remarkably effective, especially, and this is key, when it started early in the course of the disease.
That's encouraging.
Very. The drug of choice, the go-to antibiotic, is oxytetracycline. It's administered intravenously, usually once a day.
How long do they typically need treatment?
The standard course is typically for 5 to 7 days.
And I understand the response is usually incredibly quick. That must be a huge relief for owners seeing their horse so sick.
It absolutely is. You will typically see a really marked improvement, a significant drop in the fever, improvement in their appetite, their whole attitude and energy level, often within just 12 to 24 hours of that very first 5E dose.
Wow.
It's one of those treatments where you can often see a dramatic turnaround almost immediately, which is fantastic.
Are there any tricks to giving the IV oxytetracycline?
Yeah, there are some recommendations. It's generally advised to dilute it, often in saline solution, not typically lactated ringers, and administer it slowly, intravenously. This helps minimize the potential for some transient side effects like mild muscle tremors, sometimes diarrhea, or very rarely, a brief episode of collapse if given too quickly. Slow administration is key.
Okay, and what if IV administration just isn't practical for some reason? Maybe for a horse that's difficult to handle or in a field setting. Are there oral options?
Yes, definitely. If IV isn't feasible, oral alternatives like doxycycline or minocycline can be used. They're usually given twice a day for a slightly longer course, maybe 10 to 14 days for doxycycline or 7 to 10 for minocycline.
Okay.
And sometimes what vets will do is start with the IV oxytetracycline for maybe the first 1 to 3 days, get that rapid initial improvement, and then switch the horse over to one of the oral options to complete the remainder of, say, a 7-day total course at home. That can be quite practical.
That makes sense. Beyond the antibiotics themselves, what kind of supportive care might a horse need while they're recovering?
Supportive care is definitely important alongside the antibiotics. We often use NSAIDs, non-steroidal anti-inflammatory drugs like flunixin miglumin, which is Banamine, or maybe firocoxib, Equiox.
Right, for the fever and pain?
Exactly, to manage the fever, help with the muscle soreness, and reduce that inflammation. Stall rest is usually recommended while the horse is acutely ill, just to let them recover. And leg wraps or bandages can help manage that limb edema, provide some support.
What about hydration?
Crucial. Encouraging them to drink is important. And for horses that are really severely debilitated, maybe not eating or drinking well, intravenous fluid therapy might be necessary to correct dehydration and support their circulation.
Any role for steroids, like dexamethasone?
They're rarely needed for EGA, thankfully, but they might be cautiously considered in very, very severe cases, perhaps those with profound systemic inflammation or those rare neurological signs we mentioned earlier. But it's usually not a first-line supportive therapy.
Gotcha. And just a quick but important note on those tetracycline antibiotics. Are there any major precautions owners should be aware of?
Yeah, it's good to mention. Tetracyclines, as a class, can potentially retard skeletal development in a fetus and can cause discoloration of deciduous or baby teeth. So they're generally used with caution in pregnant mares, especially during the first half of gestation.
Okay.
And like many antibiotics, they have been associated occasionally with gastrointestinal upset, like enterocolitis. Less commonly, things like photosensitivity, increased sun sensitivity, or kidney issues, nephrotoxicity could potentially occur, though usually related to high doses or prolonged use. But overall, they're very effective and generally safe when used appropriately for EGA.
Okay. Now, prevention. Always better than cure, right? Especially with these tick-borne diseases. What can owners actually do to protect their horses, given that there isn't currently a vaccine for EGA?
That's the key point. Since there's no vaccine, prevention really comes down entirely to diligent tick control. It's all about minimizing exposure to those infected ticks.
So what does that look like, practically?
Well, first, on the horses themselves. Daily, thorough tick checks are absolutely paramount, especially if they've been turned out in pastures bordering woods or trails with tall grass or brush.
Where should you look specifically?
You really want to focus on common hiding spots. Check carefully through the mane and tail, inside and around the ears, in the armpits or axilla region, the groin area, and under the jaw. Basically anywhere warm and protected.
Okay.
And if you find an attached tick, prompt and correct removal is critical. You want to grasp it close to the skin and pull straight out. And then using topical permethrin-based repellents or acaricides products specifically designed to kill or repel ticks can offer a lot of protection. Following the label instructions is important there. Even simple physical barriers like fly sheets and fly masks can help reduce the areas where ticks can easily attach.
And what about managing the environment, the pastures or barn area?
Yes, environmental management plays a role too. Simple things like mowing pastures regularly, clearing overgrown brush, removing leaf litter, and cutting down tall vegetation along fence lines can significantly reduce the tick habitat right where your horses live.
Makes sense.
In areas where you have a high deer population, sometimes considering deer fencing can help limit tick introduction by deer. And basic rodent control around barns and feed storage areas is also a good idea, since rodents, as we mentioned, are important reservoirs for the bacteria and hosts for young ticks.
Okay, good tips. And just to reiterate a point that's often a huge relief for owners, I think we mentioned it, but it bears repeating, EGA is not contagious directly between horses, right?
Absolutely correct.
Yeah.
Zero direct horse-to-horse transmission. So if you have a horse diagnosed with EGA, you do not need to isolate them from your other horses for fear of spreading this particular disease. The risk comes solely from infected ticks in the environment.
That's really good to know. So let's talk prognosis then. If a horse gets EGA and it's caught early and treated, what's the outlook?
The prognosis for EGA is generally considered excellent, provided it's diagnosed reasonably early and treated promptly with the appropriate antibiotic, usually that IV oxytetracycline.
So most horses bounce back pretty well.
Yes, absolutely. Like we said, most horses show that significant improvement within just 12 to 24 hours of starting treatment. Full recovery, getting back to normal, typically occurs within about 2 to 3 weeks.
And what happens if it goes untreated? Do they just stay sick?
Well, interestingly, many horses will eventually recover spontaneously, even without treatment. However, the illness will be much more severe, it'll last longer, and there's a significantly higher risk of developing secondary complications.
Like what kind of complications?
Things like really severe edema that could cause skin issues, or that ataxia, the incoordination, which could potentially lead to falls or injury, or even secondary bacterial infections setting in because their immune system is compromised during the illness.
Okay. And mortality. Is it fatal often?
Mortality is actually quite rare with EGA. It typically only occurs in a very small percentage of cases, usually those that are exceptionally severe, perhaps diagnosed very late, or complicated by other health issues. And it's worth noting again, laminitis, which is a big fear with many equine illnesses, is thankfully not typically associated with this specific infection.
That's another relief. What about immunity? If a horse has had EGA and recovers, are they protected?
Generally, yes. Horses that recover from a natural infection with EGA are considered to have pretty solid immunity for at least 2 years.
Oh, good.
Reinfection is possible after that period if they get bitten by another infected tick. But the good news is we don't believe horses become long-term carriers or develop a latent state where the bacteria hides out. Once they clear the infection, it seems to be gone.
Okay. So if we kind of tie this all together, connect it to the bigger picture for owners, the key takeaway here really seems to be the power of early detection and quick intervention, doesn't it?
Absolutely. Knowing the signs that fever, lethargy, maybe swelling or petechiae, especially during tick season in an endemic area, and getting your vet involved quickly makes all the difference in how smoothly and rapidly that horse recovers.
So we've definitely unpacked the mystery of equine granulocytic anaplasmosis today. We've looked at what it is, how it shows up in your horse, how vets pinpoint it, the really effective treatments that are available, and crucially, the importance of that tick prevention piece. Our mission was to cut through the complexity. We really hope you, our listener, now have a clear, actionable understanding of this disease.
And considering just how effective that rapid treatment is, it really does raise an interesting question for the future, perhaps. How might a deeper, maybe more localized understanding of tick populations, knowing exactly which ticks are where and what percentage of them are carrying Anaplasma phagocytophilum in specific areas, how could that knowledge further enhance our proactive prevention strategies? Could we target prevention even better?
Hmm. That's definitely something to mull over. Food for thought as you continue your own learning journey about keeping your horses healthy. Thank you so much for joining us on this deep dive.